Hello, hello, I'm back again. And as promised, we have to go over this case study. Remember the case study from yesterday? I have the answers. All right. So we're going to go through it. We have to do our clinical reasoning and we have to use our process of elimination. So if you missed the question and the case study, the case event and everything, then go back to yesterday's YouTube, which should be entitled Tell Time Thursday. It says case studies, NGN case study for today, Tell Time Thursday. So that was on yesterday. And also earlier today, I posted the party because I want you guys to know that it's a party. It's time for party. It's time to celebrate tomorrow. So I hope you're planning to join and come tomorrow. Tomorrow night, 7 p.m. is the webinar. All right, so our question is, which instructions should the nurse instruct the caregiver when demonstrating the installation of the OTIC prescription for the client? OTIC or OTIC? OTIC, I think is a better way to say it to distinguish it from optic, because this is the ear, not the eye. All right, should we instruct the client to remain in the same position for 5 minutes after medication administration? All right. And like I mentioned yesterday, after you give somebody some eardrops, you don't want them jumping around and walking around and prancing around. And remember, this was a child, I believe a 4-year-old child. And so we want this child to sit still and be calm and keep them occupied, 4-year-old male child, so that those eardrops soak in and absorb into the ear. Should we gently press the tragus? Remember, the tragus was that inner portion of the ear. Go back to that video yesterday. It's that inner portion that sticks out kind of in the center of your ear. Some people have a very prominent tragus, some people not so much. Some people get it pierced. So not the earlobe, but the inner part that sticks out. Should we gently press? I like that word, gently press, after administering the medication. Yes, we should. All right. So that one we're going to keep. We don't want to eliminate. And what does that do? So after we instill the medication, you want to have the client remain in the same position for 5 to 10 minutes. So at least 5 minutes, but up to 10 minutes. And you're going to press the tragus to help disperse the medicine so it gets all around within the ear canal. All right. What about the next choice? Pack the ear canal tightly. And remember, I mentioned about that word tightly. I didn't like that word. That's a trigger word. And yesterday my ear was so sore. Thank God today I'm doing a lot better. My ear was so sore you could not pack anything tightly into the ear. But maybe just gently, a little cotton ball on the end. I was doing that when I was putting the eardrops in, but definitely not packing anything tightly. Cotton can be loosely applied if prescribed, but not tightly. And most things, even for wound care, when we're packing a wound, we're not going to pack it tightly. So that's out. Pull the earlobe down and back prior to administering the medication. So remember, we mentioned that we had to know the age of the patient, or at least the developmental stage, to know should we go up and back or down and back. Now, this is a 4-year-old male. If you remember from the case study from yesterday, they're 4 years old. And for 4-year-olds, which way should we go? Do you remember? So the nurse is going to pull the earlobe up and back for children older than 3 years to straighten the ear canal. Now, if you missed that, you might have thought, well, it's child down, adult up. But remember, when they mention that, there's no age. So you got to know the age. The age is going to be up like the adult if the child is older than 3 years. So this was a 4-year-old. So we want to pull his earlobe up and back, not down. Under 3 and under, you're going to go down and back, child down. So you want to know which age group, when is that cutoff time frame for up or down. Should we irrigate? Do we want to irrigate the ear canal if cerumen is present before instilling the medication? Yes, the doctor did this for me yesterday. He cleaned all that gunk out of my ear before he put this cream in my ear, and it's going to sit there and it's going to absorb for over the next 2 weeks. And he said after 2 weeks, that I should be doing fine, that I can go back to my normal type of like steroid drop. It's a drop that keeps my ears from itching all the time. And so that should help with any of these allergies and things that are flaring up this time of year. So yes, before we instill the medication, if cerumen is present, the nurse will irrigate the ear canal before instilling the meds so that it can be effectively absorbed. Now, when I went to the physician yesterday, the nurse could not irrigate because we have to do irrigation with the syringe, and you're pushing fluid in there pretty fast against the sides of the ear canal, not straight in. We don't want to damage the eardrum. But since my ear was so painful with her even just trying to look in there, it hurt. She said, nope, I'm going to have to let the provider, my healthcare provider, my physician, the ENT doctor, he had to suck out. So they use a suction method of removing wax out of the ear. And that's what he did. And it actually was quite comfortable. Wasn't really painful. I was very nervous that it was going to hurt a lot, but it was actually pretty good. It actually soothed whatever he did. He soothed the ear. He must have put some stuff in there because I felt like something was going in, but stuff was coming out. And it actually really soothed my ear. It really felt good. So I'm doing a lot better. All right. Now the medicine, we had to know what medicine it was. So it's an ear drop. And remember, the medicine was ofloxacin. Well, ofloxacin does not require refrigeration. Now, if you wasn't sure if this needed to be refrigerated, just think about the fact of something cold going in this patient's ear. Any medication instilled in the ears should be at room temperature to prevent discomfort. And yes, I don't keep any of my ear drops in the refrigerator. Even the antibiotic ones, they don't say to refrigerate. So we don't want to keep it in the refrigerator. So there was only three answers. If you got it right, give yourself a good thumbs up, pat on the back. So you should have option 1, option 2. And what is that? 1, 2, 3, 4, 5. The fifth option, second to the last. Only 3 answers were correct. All right. Good job if you got all those correct. Here are some notes for you to remember what to do and not to do for ear drops and irrigation. And an easy way to remember: adult is up, but child is down. But remember, adult is up is for children over 3. And that gets tricky. Is it 3 and up, or is it over 3? So specifically, they say it's up and back for children older than 3, because that's going to straighten the ear canal. So children older than 3. So we're going to go down and back for children 3 and under, 3 and younger, 3 and younger, 3 and under. All right. Great. So I hope you guys enjoy that case study. Tomorrow we're going to talk about take action. So we're going to deal with that case study tomorrow. I am looking forward to it. We're going to have a little party. I'm in a party mode now. I'm just celebrating. Like I said, I'm celebrating life. I'm celebrating being out of this pain and misery. 7 days of misery, guys. That is horrible. But I had to wait till I see my doctor. I didn't go to the ER or anything because I'm like, what are they going to do? And I just didn't want to have to make an unnecessary trip, and it was well worth the wait. I wouldn't suggest anybody stay in pain that long. If you feel like it's urgent, you go to the emergency, but urgent care only did what they could do. They were not going to irrigate and do all those things that I needed. So today is also Fun Fact Friday. So I do want to mention a little bit of fun fact. This comes from a publication from the NCSBN, Nursing Workforce Crisis, Healing the Healer. Sometimes we need healing. So we want to address wellness and mental health. So they have this groundbreaking 2022 National Nursing Workforce Survey that brought into focus the crisis surrounding nursing and the intention of almost 1/5 of registered nurses have left the profession. That's why I am pushing to get you guys licensed. You got to study. You got to get it done, because we need more nurses, and we need good nurses. Who's going to take care of me when I get to that point? All right. So we are at an urgent crossroads that it requires healthcare systems, policymakers, regulators, and academic leaders to put in place changes that will spur systemic evolution. So the NCSBN brought together experts from across the United States to participate in an ongoing discussion on solutions to staffing, burnout, and the prevention of workplace violence. All right, so this is an article the first article of a series of articles where they're discussing nurse wellness and mental health with two of the experts. So there is more. It's a publication. If you're interested in reading more or would like more on this publication, just reach out to me. If you like stuff like this, I can send it to you. But yeah, there's a whole publication on this, and a lot of other good news have been happening. They've been honoring some nurses. This one nurse had more than 50 years in nursing. Maybe I will elaborate more on some of these articles on our next Fun Fact Friday. There's also a residency that I saw that they offer for nurses if you're going in to become a graduate nurse. Just a lot of good news in nursing that we may not know about unless you become a member of your state boards of nursing chapter or get involved. So be involved in the politics of nursing. There is a lot of politics. There is this annual meeting coming up in August of this year. I mean, there's just so many things that you can do to be active and involved in nursing besides just taking care of patients. But if your love is to be at the bedside, that's awesome. But if you can make a difference in your unit or at your facility to be somewhat involved in what's happening to make things better, to make not only your patient's life better, but to make yourself better, to make you a better nurse, to do well by your colleagues, then I recommend getting involved. So I think this is great that they're addressing wellness and mental health for nurses, because it was a struggle going through COVID, and it was definitely a crisis, and it led to an even bigger crisis now because a lot of people left the workforce during that time or even after that time. All right, so I hope you enjoyed today's message. Hope you got this question correct. And if you're looking forward to tomorrow, I am. Make sure you look at the link below and register. It's free, so why not join 7 p.m. tomorrow, Saturday. I'll see you then. Have a wonderful night.